Hello, and thank you for joining us tonight for our free webinar, FaceTime, Diagnosing and Treating the Aging Face, featuring Shellie Goldstein. My name is Jeff Bloom, Education and Marketing Manager here at L.A.C. OMS. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. We do recommend viewing the webinar in Chrome, Firefox, or Safari, as you may experience some slowness in other browsers. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate technical difficulties, please use the Chat tab. For questions of the guest speaker, please use the Questions tab to assure that we see them during the Q&A at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the complimentary slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture to Chinese herbs to practice management, you'll find something interesting for every practitioner on the L.A.C. OMS blog. I would also like to mention a few new great features at L.A.C. OMS. We have just launched our new L.A.C. Direct Dispensary program to allow practitioners to recommend products to patients and receive a commission on those purchases. I will share a link in just a moment on the chat as to where you can learn more on how to access this program using your current L.A.C. OMS account. We also now have the ability to receive text alerts about inventory updates and other important information. All you need to do is text the word SUPPLY to 855-358-3253. I'll also put that in the chat in just a moment as well. Now for our featured speaker, I'm proud to introduce Shellie Goldstein. Shellie has 28 years of practice in clinical acupuncture, specializing in cosmetic facial acupuncture, skin, and a wide variety of related skin disorders. She has 12 years of experience in teaching cosmetic facial acupuncture classes, also with skin and skin-related conditions. And she has extensive experience working in hospitals and a wide variety of medically oriented outpatient settings. She is the founder of the Academy of Advanced Cosmetic Facial Acupuncture Training and Mentorship Program. She's the author of the book, Your Best Face Now, Look Younger in 20 Days with the Do-It-Yourself Acupressure Facelift, and the creator of Touch and Glow, the Natural Facial Acupressure Kit. Please join me in welcoming Shellie Goldstein. Oh, and Shellie, before we go live, can you do me a favor? Can you click on that little bell icon at the top of the page to mute your notifications? Do you see that right next to the
I did it. Perfect. Does that work?
Now, yep, it's perfect. All right, I'll see you for questions.
Hi, everyone. I'm looking in the chat, and I so many names that I know. So thank you so much for coming tonight. I know there's a lot going on in this country and in the world, and so thank you for taking a break and coming to listen to me, and I'm going to entertain you. This is also an interactive webinar, so I will ask you questions, and if you can put your responses in the chat box. So if you have questions, put them in the question box, and if you have something, if we are communicating or talking back and forth, then let's just chat. So here we go. Yes, 28 years. That makes me feel so old. So I graduated from acupuncture school in 1991. And at the time, I couldn't get licensed. So I went to China and studied in a hospital. I got put in the facial dissection, or in the facial unit, and learned a lot about faces. Came back, got licensed, and immediately started working for cosmetic treatment. And it was a little lonely. I mean, there weren't that many people out there. And then one day in 2007, this happened. This is an article from the New York Times Style magazine, and it's how to lift your face with number 2 hands, 30 needles and no knives. Well, that just completely turned my business around. And people started knowing about facial acupuncture. They were getting interested in it. And it was great from there. So fast forward a little bit, in 2014, the NCCOM started an acupuncture facial rejuvenation certificate needs assessment survey. And they polled a number of acupuncturists around the country and asked them about facial acupuncture and what the needs were and whether it would be something they were interested in. So based on those acupuncturist responses, 62% of their patients inquired about acupuncture for appearance enhancement. That's a lot, 62%. So that was great information. It was good to know. And moving forward to today, cosmetic facial acupuncture is one of the top 3 most popular specialties among acupuncturists in the United States. So I asked myself, why? Why are people coming in for any type of facial acupuncture or cosmetic acupuncture? And there are a number of things that I came up with. We are driven by the baby boomers and now the millennials. And both of those generations, there's this this movement towards something that's more natural. Rather than having that tight, pulled back appearance, they want something that's more natural, that's more holistic, and that helps them to heal their body as well as what's on the surface. So it's really the desire for a natural alternative that's congruent with their belief system about health and well-being. A number of my patients come in for prevention and some come in for correction. But then what I think is the most interesting at all is this concept of being conflicted with their aging. So call it your midlife crisis, call it whatever you want, but it's that moment in time when someone looks in the mirror and they say, oh my God, I'm changing. I look like my mother, I look like my grandmother, my father, whatever. But it's this moment, and we probably come up with it as acupuncturists a lot, where there's this shift, and it's a conflict, particularly for people who are dependent on their looks to get their validation from the outside world. So whether it's their self-image, how they perceive themselves, how others perceive them, it's shifted, and it's not who they think they should be or who they want to be. So for me to be able to make a difference there is huge. I created this tool. Actually, I didn't create it, my sister did, but she uses it for a skincare line that she made, but I use it as an instrument-assisted acupressure tool. And it comes with this point-prescribed acupressure appearance enhancing protocol. What's interesting about this is I ran a pilot study to make sure that it worked. And it was a 20-day regime. People would do the treatments, and then they had to fill out questionnaires before and after each session, but then also a quality of life before and after. So there was after 20 days of daily use, participants reported statistically significant improvement in wrinkle reduction, face tone, eyes, brows, cheeks, jawline, neck, skin quality, but self-image. And then to me, that was like the aha. If I can make a difference in somebody's, the way they feel about themselves as a person and heal that wound or that trauma that's going on, then I've done my job. So I have a saying that's truly, in the truest sense of the word, of finding beauty from within. When you feel good, you look good, and looking good helps you to feel better about yourself. So let's look at this in relation to Chinese medicine and aging. Treating the aging face is based on the principles of Mai Rong. Mai Rong means beautiful appearance. And in Asia, it was practiced throughout centuries as part of a holistic regime. It was used to enhance beauty, delay visible signs of aging, and promote systemic health and well-being. It was used in the form of acupuncture herbs, whether they be topical or ingested, and it was notably used by the ancient Chinese empresses and by empresses to keep their concubines looking beautiful and healthy. Although we say it was an elite service, I seriously believe that there are variations of Mai Rong regimes utilized throughout most households. And when we think about this treatment, it's not just putting needles in the face. What we're really doing is we're treating the aging face based on the principles of Chinese medicine. So we know as acupuncturists that aging is directly influenced by the disharmony in the qi, blood, fluids, meridians, zang fu organs, and their systems. So when we're looking at qi and blood and the meridians and the organ systems, what we're looking at is that disharmony or that disease. And in our aging faces, we're looking at the quality of qi and blood in the meridians and organ systems, either insufficient or excess. The quality of qi and blood, meridians and organ systems, either again, insufficient and excess. And as acupuncturists, we know that those changes or those disharmonies are either internally or externally generated. So they can be inherited, they can be acquired, or they can stem from pathogenic factors. Looking at the organ systems, well, I'm going to, as a TCM practitioner, I look at the organ systems and their paired attributes, and then within those systems, specific attributes that are related to those organ systems. So for example, with facial acupuncture and treating the aging face, we're looking at the heart and the small intestine, the pericardium, the sangao as one unit. And what we're looking at within that is the concept of blood vessels. And when we translate that into our world, we're looking at one's complexion. We're looking at fine lines. We're looking at broken capillaries and rosacea. When we are looking at the spleen and the stomach, we're looking at the muscles, the integrity of the muscles. Do they get weak? Do they attenuate? What's happening to that shift in the muscles and muscle tone in the body and in the face? When we look at the large intestines and the lungs, we're looking at skin, the relationship from the large intestines along terms of skin quality. So we're looking at things like texture, pore size, acne, and different types of skin conditions. When we look at this kidney and the bladder system, we're looking at the bones, and we as acupuncturists know that the kidneys and the bladder affect the way that we age from birth through death and that transition. So in aging faces, we're looking at premature signs of premature aging. We're looking at fragility of bones and bone resorption. And then with the liver and the gallbladder, we're looking at ligaments and tendons. And for us, it means how are muscles contracting? Are they contracting smoothly or not? And the results of the way that ligaments, tendons, and muscles contract in the face is going to determine the depth of skin creasing and wrinkles. So you may be starting to get this now, but in our world, facial concerns, wrinkles, sagging skin, muscle tone, and skin discoloration, etc., are all just symptoms of an underlying pattern of disharmony. So as part of treating the face, we need to treat the root, or those patterns of disharmony, and we treat them with body points. And then we treat the symptoms, the wrinkles, the sagging skin, the muscle tone changes, etc. Those are our branch symptoms, and we're going to treat those on the face as a branch treatment. So from a biomedical perspective, let's look at the face and let's start to learn how to look at the face and how to diagnose the face as it ages. So on the left, the younger face, you see the top of the triangle is right underneath the eyes, and the bottom of the triangle is at the chin. So we're going to divide the face up into 3 layers. The upper third from the forehead to right below the eyes. The middle third is from right below the eyes to above the lips. And then the bottom third are going to be the lips going down into the jawline. Now, in our younger years, the height of the face, or the bottom of that triangle, is elevated to the top of the middle third of the face. So when you look at someone, and when someone looks at you, where does your eye go? It goes right here. It goes right to the base of the triangle, or the height of the face and the width of the face. As we age, that triangle starts to flip. So now the weight of the face is actually at the base of the lower third. So it looks as though the face is heavy, heavier below. And that's when people will say, I look old, I look tired. Well, in fact, what's happening is the weight of the face has actually shifted from the upper, the upper part of the middle third, and it has shifted down to the bottom of the lower third of the face. So clinically, this is what it looks like. In the chat room, what do you see? What do you see from the left, from the younger face, moving to the aging face? What symptoms do you see? Just put it right in the chat room. Don't be afraid. More jowls, sagging, good. Cheese sinking, sagging, jowls, great. Yep, got it. Lines, jowls, perfect. Good job, everybody. Thin lips, that's a good one. And under eyes, perfect. So here's what's happening. Remembering that the weight of the face is starting to shift. So in the younger image, you can see nice open forehead, eyes wide open, and a wide cheekbones. We call these the zygomatics. They're nice and wide and lifted. As we start to age, you can actually start to see the visible changes of the aging face, moving the weight from that open upper third to the weight shifting down to the lower area or the lower aspects. So that's right. You're going to see jowling. You're going to see sagging in the cheek area. You're going to see this. This is what's happening. In the forehead starts to shorten. You start to lose distance between the eyebrow and the eye. So you start to get hooding or eyelid ptosis. And then as the mid face starts to drop, not only does it drop down, but it also moves medially. Do you see that's the red lines and the trajectory or the angle of those red lines moving not just down, but medially towards the center of the face. Now, clinically, what you see is creasing across the forehead, creasing between the eyebrows, puffiness and creping under the eyes. You'll start to develop a fold from the nose to the mouth, nasolabial fold, wrinkling above the lip, but below the nose, above the lip. You'll start to develop a fold from the corner of the mouth, moving down to the jawline, creasing below the lips, the mental area, and then loss of definition of the jawline and fullness and creping of the neck. So one of the things that's nice about specializing is patients come in with a certain set of complaints. And for the most part, in our world of the aging face and treating the aging face, here's what we're going to see. People will come in and they will say, oh, for the upper third, they're going to talk about wrinkles across the forehead, between the eyes, eyelid ptosis, which is the lid of the eye dropping, and under eye puffiness and darkness. In the middle third, they're going to see cheeks sagging. They're going to see creasing in the cheek area. They'll see that nasolabial fold from the nose to the corner of the mouth. And then in the lower third, they're going to complain of more wrinkling around the mouth, marionette lines are the lines that move from the corner of the mouth to the jaw area, a mental crease, which is a crease above the chin, swelling, sagging skin, loss of definition in the jawline, and neck sagging as well. And overall, they're going to say, oh, I just feel awful. I look old. I feel tired. And their complexion might not look great. They may have a dry, withered, or dull appearance, uneven coloring, hyperpigmentation, sunspots. And adults get acne. They can get breakouts in acne and rosacea as we age. Now, for me, the effectiveness of my ability to get good results really resides in understanding the relationship between Eastern medicine and biomedical anatomy with regard to the morphological faces over time. So what are we talking about? We're talking about skeletal reabsorption and soft tissue maturation. So let's give you the Cliff Note version of anatomy of the face, and I think it will be really helpful in terms of being to diagnose the face. And then pay attention, because I'm going to ask you questions afterwards, and we're going to start diagnosing faces, and you'll see a huge difference in what you are able to see. So let's start from the left, the skeletal tissue, moving to the right as we move from the deeper surface to the more superficial area of the skin. We're going to start with bone and move to soft tissue, which includes muscle, fat, skin, and everything else in between. So this is the aging story of our bones, of the skeleton. So don't look at the bottom, but look at the skeleton on the left, and then look at the skeleton on the right. This is a CT image of a female between the ages of 20 and 40 on the left, and the skull of a woman over 65 on the right. So as you can see in the image on the left, the bones are horizontally and vertically lined up. They're nice and thick. They have a lot of structure to them, and you can feel the solidness of the bony structure. When you look to the right, what do you see in the chat box? Don't look at the notes. Is there anything in particular that stands out for you? Okay, so great. Somebody knows their anatomy. This is great. Perfect. So yes, so one of the things that happens is the frontal bone starts to shrink. The eye sockets get bigger. So why do eye sockets get bigger? Because the bone that shapes the eye itself is actually starting to break down. We call it resorption, bone resorption. So the bone is actually breaking down. So visually it looks as if the eyes are getting larger. In addition, you see the temporal hollowing, that temporal side, you can actually see it starting to break down. So the bone is breaking down, and as it breaks down, you get these visible changes. In addition to the temporal hollowing, or the temporal area, the nasal piriform, the nose, starts to widen again because the bones around the nose opening are starting to break down and resorb. And the same goes with the maxilla, the bone, upper bone, and the mandible, the loose bone of the jaw area. They too are starting to break down. Now, when those bones start to resorb and break down, you lose the amount of space in your mouth. So the teeth actually buck forward, and you start to see this clockwise rotation. Those are the blue areas, this clockwise rotation of the skull, so that everything starts to push forward. It looks like this. So again, you have breakdown. Look where on the image where the blue areas are the arrows are moving into dark areas of the skull. That's where the primary areas of bone resorption occur. So again, around the eyes, forehead, eyes, into the mandibular area, the nose, nasal piriform starts to open, the jaw area starts to degrade and get longer, and then it causes there's less space in your mouth, so the teeth start to push forward and you start to get that rotating. Now, remembering that the skeleton is actually the support system for the rest of the face. So look what happens. As the skeleton models and resorbs, all of the tissue on top is going to collapse due to the lack of structure that's supporting it. So when we look at this soft tissue, again, going back to this other side, what are we going to see? We're going to see moving from deep to superficial, the underlying tissue that sits on top of the bone are your muscles. They're supported by fascia, deep and superficial fascia. And then there's another layer on top of that called the subcutaneous layer, which is where all your fat is. And then on top of that is the skin and the dermis. Those all run in horizontal plane. Running vertically are retaining ligaments, and those are the little plugs that help to support the rest of the face. So here's, some people like to see it in pictures. I certainly am one of those. So you can see the bone is the area in the black. You can see the fascia is supporting the muscles. The muscles are the little red circles. And then on top of that is the subcutaneous tissue. And then on top of that is the dermis and the epidermis. Again, and then if you look on the stacking side on the right, you can actually see the plugs or the retaining ligaments that are supporting that tissue. So let's look at muscles. All right, there are two kinds of muscles. There are deep muscles and there are mimetic muscles. There's the superficial mimetic muscles. Mimetic muscles differ from the muscles of the rest of the trunk. So rather than moving bone or the bony attachment, they move muscle and skin. So take your arm, flex your bicep. What happens? As you flex that muscle, the lower aspect of your arm starts to elevate. If you relax your arm muscles, the bicep muscles, it goes down. Those are the muscles moving bone. On the face, the mimetic muscles, what their job is to do is rather than moving the bone and attachments, they're going to move other muscles and other skin. So these mimetic muscles are attached either from bone to muscle, muscle to muscle, or muscle to skin. And when they move the skin, and that's how we get our expressions. So all of the expressions that we make, the ability for me to sit here and chat away, the ability for us to blink, to furrow our eyebrows, to smile, to frown, those are all determined by the mimetic muscles, or those muscles of expression. As we age, so we talk about body muscles, and we talk about the body muscles atrophying, and generally muscles atrophy because they get weak from not being used as much. Well, the muscles of the face, both the deep and the superficial muscles, move a lot. So it's not, they don't necessarily atrophy, but the word that we use is attenuate. And when we talk about muscles attenuating on the face, we're talking about the force of the muscle contraction and the magnitude of the muscle contraction. So with age, these muscles either start to straighten and stiffen, and that means their amplitude can't move as much. So think of a rubber band. A rubber band is fresh. A fresh rubber band is, you pull it, it snaps. It's actually, nice elastic quality to it. What happens to a rubber band that's years old? It starts to get dry. It starts to get creepy. It doesn't have the resilience or the ability to snap that it used to. And so as similar to muscles of expression and the muscles of the face, the same thing happens. They get a little stiffer, they get a little straightened, they reduce in amplitude movement, and it leads to that appearance of a frozen movement, and then of course deeper wrinkles. Are there any questions so far before I move on? Nope, good. Okay. All right. So now muscles, deeper muscles are, yeah.
Sorry to interrupt. Actually, do have, looks like, one question.
Okay, shoot.
Mallory would like to know, are birthmarks considered an underlying pattern of disharmony that occurred during gestation? Is there a chance for correction, with quotes?
That's a good question. You know what? Hold on to that one, and then ask me later. But that's a really good question. Thank you. I like questions. So,
right. And then also just to mention to everybody, anyone who arrived late, you will all receive a link to the replay 5 minutes after we end. So don't worry, you won't miss out on the beginning portion of it. All right, now I'll get off.
Okay, great. So I just want to comment on Eleanor. It says it's not that, we're going back to the bone structure, I think it's not the same woman, so you can see differences. Can we draw the conclusion that it relates to aging? It does relate to aging. There was a 40 to 60, 40-year difference between those two. And yes, the purpose of that slide was to demonstrate bone resorption and what it looks like. Now, obviously, everybody's bones are going to resorb differently, but in general, those are the patterns of what we can see. Thank you. Okay, so now let's go back to the muscles. So muscles, the deeper muscles are surrounded by deep fascia, And the purpose of that deep fascia is actually to isolate and to protect the muscles. And then above, the superficial muscles are surrounded by a more superficial tissue, and we'll talk about that in a minute. So in terms of layering, you have bone, muscles, fascia that connects the muscles and isolates and protects them. And then moving up, you have the subcutaneous and the dermal layer and the epidermis on top. So the deep fascia divides, supports, and protects the deeper muscles and vessels. Now there's something very unique to the face, and that is the superficial musculo-ophthalmic system, or the SMAS layer of tissue. It's a thin layer of fascia that's filled with collagen, and its job, it drapes from the temporal region straight down over the cheek area and then over the muscles of the neck. And its job is to connect all of the mimetic muscles of the face, those superficial muscles of expression, to the surface of the skin, and then it amplifies the activity of those facial expressions. So you have the muscles moving, you have the skin, and then you have that SMAS layer that actually keeps it together, so you can actually, the muscle movement is actually projected on the surface of your skin. The elasticity of that SMAS layer is really important. And so as we age, that elasticity and contractile quality, similar to that of the muscles, starts to dry and become rigid, and then again adding to that stiff appearance of an aging face. So this is what fascia looks like. It looks almost like a little web. And then this is fascia of a cadaver. And you can, obviously the huge change that happens, but just to point out that the A is more superficial fascia, and then B is a more deeper fascia. This is a neck. You can actually see the jaw area and the fascia, which is holding everything, the platysma muscle, together. On top of muscles and fascia, we have the subcutaneous layer, and that's your facial fat and adipose tissue. Now, fat in the face isn't equally distributed. It's pocketed and compartmentalized. And in the face, if you look at the age 35 image, you see the primary areas of those fat pockets are around the eyes, the temporal region, a lot fuller in the cheek and in the jawline. And fat is actually what gives face volume. You want fat. And so that as we age, what happens is we say it starts to descend and deflate. So you can see in the age 45 moving to age 55. Now, I actually think these numbers are pretty low. I would probably put the center one at around age 55, and the age 65, 55, I would even take that up 10 years, or at least. But clinically, what you're going to see is as those fat pockets start to descend and deflate, you get hollowing in the face. So that hollowing occurs in the primarily in the cheek area, under the eyes, in the cheek, and then along in the jawline as well. And remembering in the other image where things start to move more medially, the fat is also going to move more medially as well. So what it's going to do is accentuate that nasolabial fold. It's going to give you a flattened forehead, flattened glabella area between the eyebrows, periorbital starts to hollow out. In addition to the bone resorption, you're going to get temporal flattening here, malar flattening. You're going to get flattening in the cheek area, around the mouth, and then along the jawline. On top of fat, you can see the bottom layer of the image, the little yellow circles, that's fat. And then the top layers of skin are called the dermis and the epidermis. The dermis is the blue area in the middle, and the top area is called the epidermis. The epidermis is what you see when you look in the mirror, and it's what you see when you look at somebody else. that's what we call visible health. The true health of the skin actually resides in the dermal layer, or in that middle layer. So cell growth starts at the base of the dermal layer, and as it floats up in this very, very aqueous solution of hyaluronic acid and fluid, it has all of the nutrients that are there, a lot of proteins, nerves, vessels, a lot of nutrients are floating around in that dermal layer. And the cells absorb those nutrients and they grow nice and healthy and they move up to the surface. In the dermal layer, they're about 85 to 95% water. As they start to float up to the surface, up to the epidermal layer, that's when it's the brown areas. What's happening is the cells are actually losing their water content, losing their vitality, losing their health, and they're actually dying as they're making their way up to the top. When they get to the top, and so on the top, they actually die. They need to slough off and make room for the growth of the new healthier cells that are coming in. As we age, or you're looking at skin aging, a number of things occur. So the cells that are moving up to the top, they are losing their water content. They are getting drier. It takes a little bit longer for that whole system. It's a 30-day cycle approximately to occur. As they float up, they start to lose their quality of health, which creates the little blue circles. That's the line between the dermis and the epidermis that starts to get thinner and separate, which means skin becomes even drier. We have a degradation of collagen and elastin in the dermal layer. So the horizontal and the angled lines in the center are starting to, the collagen and elastin are starting to degrade. And you basically lose skin plumpness. It gets less supple and it starts to pit. Now, pitting is different than a wrinkle. You can get wrinkles from this, but primarily pitting, the main place you'll see it, and I actually have it, it starts right here in the cheek area. It starts to get sunken and a little hollow. That's loss of collagen, whereas a wrinkle is something a little bit different, and we'll talk about that later. And then last but not least, we have retaining ligaments, and those are the plugs that run in a vertical position and they keep all the horizontal levels in alignment. And as you can see, the retaining ligaments are strategically placed around the eyes, along the zygomatic area, under the eye, in the cheek area, in the masseteric area of the jaw area, and along the mandibular septum. So what they're really doing is they're holding the skin in place, holding everything in place. So and stabilizing the soft tissue planes. So as we age, what happens, like everything else, they attenuate, they lose their structure. We call it a decreased interfacicular lubrication. Basically, it means they get dry. And again, moving forward into that medial plane. And when that happens, it brings with it all the skin and tissue, which actually exasperates that appearance of deep folds, wrinkles, prominent gelling, and loss of that malar projection. So now, here we are. Look again in the chat area. What do you see in terms of changes from what you just learned? Put it in the chat. I want to see what you have to say. What changes do you see? From the left to the right. Line sinking, hollowing, good. Pitting in the cheeks. Eyelid ptosis, great. Shortening of forehead, move. Everyone, what an amazing class. This is great. Medial shift. All right, so you get it. So now does it look a little bit different? Okay. So now when you analyze the face, either in person or in online, if you're doing tele-treating, then you can actually start to see a difference, and you can start to understand what happens when you reflect the skin back and you take a look what's going on underneath. So what is going on underneath, just as a recap, you have changes in the skin, you have fat redistribution and breaking down, you have the collagen breaking down, you have all of the fascia changes, the ligament changes, and then you have the bone changes, underlying skeletal changes. Okay, so we know from treat as acupuncturists that acupuncture can slow bone resorption, it can improve muscular activity, it can delay signs of tissue breakdown, it can encourage healthy collagen production. The research is there. There's a lot of research out there and a lot of great research out there regarding the benefits of acupuncture. So there's a great paper with Yang Li at acupuncture targets osteoblast proliferation and differentiation by stimulating mesenchymal stem cell precursors, acupuncture and muscles. We know from research that, particularly that of Anda, that acupuncture downregulates genes involved in muscle breakdown while upregulating protein synthesis. There is literature out there that helps to prove that acupuncture restores resting mimetic muscle tone. We know from the work of Des Fernandez, he's a physician in Australia, that acupuncture creates, when we put acupuncture needles in, when we do derma rolling or any type of needling plum blossom, that acupuncture creates that natural wound cascade to release growth factors and stimulate the production and deposition of collagen and elastin in the dermis. And there is an open label single arm pilot study demonstrating the effectiveness of acupuncture enhancing facial elasticity. That it's although it's an open label single arm pilot study, there's good, the information that came out of it is pretty good. So you have your patients, you decide that they're good candidates, or they've come in and they want to be good candidates. Here are the questions they're going to ask you. What results can I get? How long will it take? And how long will it last? How long will the results last? So here's what you can comfortably tell them. What happened? Come back. Okay, thank you. So we know what happened, right? So what you can comfortably say is that externally, acupuncture can help soften deep wrinkles. It can improve muscle integrity. It can correct and heal skin problems. It can even skin texture, color, and luster. And it can enhance overall appearance and vitality. I see these over and over and over again. Internally, from our knowledge about Chinese medicine and our acupuncture skills, we know that we can help improve physical, mental, and emotional well-being. And with our acupuncture skills, we can adjust the organs, meridian, other systemic imbalances. Regarding the length of treatment, how long it lasts, and the results you can obtain, and how fast will it happen, you can get short-term results in one treatment. If you want those longer lasting results, then you definitely need to do more treatments. And we say an average of 10 to 12 treatments, or when you're satisfied with the results of your treatment. In that case, we recommend that people move into a maintenance. And maintenance is usually anywhere from 3 to 5 weeks. It's when you look in the mirror and it's not looking that great. And then at that point, you really need to get yourself in there for treatment. And within a treatment or two, you can pop it right back up and you can get great results. And we say it's like taking your face to the gym. You can realistically get 5 to 10 years younger in your appearance. And obviously, we're all going to age with time. So, but that aging is incrementally slower. Now, there's a deeper conversation that's going on. And for me, I think this is even more important. You want to know really, why are they coming in? So are they coming in for prevention or correction? How old are they, and where are they in that lineup of three images? you also want to know, what do they really want? Over and over, and those of you out there, I see, Michelle, you're there too, and I'm sure that what happens is sometimes people will come in and they have a wedding, they're either getting married or they know someone that's getting married, or they're the parent of someone that's getting married, and they want results, they want fast results like that, and then you'll never see them again. That's fine. So you just pack the treatments in nice and tight, and then you probably won't see them again. I keep saying there's no audio. Can people hear me? Hello? Jeffrey, are you there? Okay, good. All right, thanks. All right, so, and then the other, if they're there for long-lasting results, then you can slow it down a little bit. You can see them weekly, you can see them, well, weekly is pretty good. And then you want to know, what do they want? Minimal results? Do they want drastic results? And then realistically, what can you do? So, and then there's also that question of, remember when we were talking earlier about the midlife crisis and that conflict with self? That's when this is the time for that conversation. So when I'm working, I really spend maybe 10 minutes. Well, they'll fill out their intake form, and then I'll go through things, and I'll whip through that in about 5 or 10 minutes, because half the time they're, putting on their best face forward, and they're not always telling you the truth. But then I do their tongue and then I get them on the table. And that's when this conversation happens. Like, why are you really here? What's going on? What do you want to do? And you ask open-ended questions, let them talk. If you let your patients talk, they will tell you everything. You just have to make the space for them to talk. So then if you can't help them, you refer them to someone else. So with the analyzing, you can do that again in your office. A lot of people are doing telemedicine, so you can analyze them online, all that. With treatment, there are 2 ways. So first, I'm going to talk about acupuncture. And one of the things that was most helpful for me is when I figured out the healing depth and the angle of insertion, dependent upon the target tissue. And one of the places that I found my information was, believe it or not, in the Ling Shoe. So throughout the Yellow Emperor's Ling Shoe, there are numerous discussions about needling guidelines specific to the layers of the skin flesh, area between the flesh and the channels around the muscles and at the level of bone. And it comes up over and over and over through the Ling Shoe. So just to paraphrase, in chapter 1, they talk about the skin, the flesh, the muscles, the tendons, and the meridians occupy different places in the body, and that different diseases respond to different methods of treatment. And then they move into, in chapter 7, there's a little more detail about, if illness is superficial and needling is deep, it will penetrate and injure the good flesh. If illness is deep and the needling is superficial, results won't be obtained. So then I started thinking and working. And what I realized is that the depth of insertion makes a huge difference. So if I'm going to treat the epidermis and the dermal layer, I am going to angle my needle relative to the surface of the skin at a 5 to 15 degree angle. If I want to address the subcutaneous or that adipose tissue, it needs to be angled into the sub-Q level at a 15 to 20 degree angle. If I'm moving in treating muscles, I'm going to angle it a little bit deeper at say a 45 to 60 degree angle. And if I'm moving into the bone, I'm actually going to go right into bone and bone tap. Now, that being said, on the face, the space between the forehead and the bone is right there. It's not that far. Whereas relative to the cheek, where you have a much more depth to play with. So determining the types of treatments that you might see in an aging face, and again, we're talking about prevention and correction. If you're going to needle into the epidermis and the dermal later, you're going to use it to, say, maintain the skin integrity or treat skin conditions, acne, rosacea, dermatitis. You can use it to treat wrinkles. We didn't really get into the lymphatic system in this lecture, but inflammation, pain, all great to treat at the dermal and epidermal level of tissue. And this doesn't go for just skin. This can go for any type of a body treatment as well. If you're going to adjust or treat, prevent, or correct the subcutaneous or the subcutaneous level of the adipose tissue, you're going to needle into the subcu for any type of prevention or preservation or any type of thermoregulation. If you're going to need into the muscle layer, you will do that for wrinkles, some types of wrinkles, muscle integrity, or any type of damage, injury to muscle tissue or muscle-related disorders like TMJ, TMD, that type of thing. And bone layer needling, again, will really help to stimulate that osteoblast and to prevent and preserve skeletal resorption or any type of injury. And again, I would even move into the bone layer for TMJ or TMD. So again, asking that question, are we doing preventing? Are we doing correction? And all of those, that make a difference. So let's put a treatment together and see what we get. So again, just to recap that we're going to do a treatment. You are remembering that the facial concerns, the wrinkles, sagging skin, muscle tone, skin discoloration are really just symptoms of an underlying pattern of disharmony. So with your body points, you're going to treat the root, and then you're going to use face points to treat the surface or the branch treatments. So here's your muscles relative to, here's your face relative to muscles. The meridians, the yang meridians are on the face, remembering there are no yin, primary yin meridians on the face, except for the CV. And the trajectory of the points overlaying onto the muscle tissue. Now, my favorite points, and obviously if you have other points that you like, go ahead and use them, but these are some of my faves. So for the forehead, yin tang, bladder 2, 3, there's a point right about half a soon above bladder 2 that I like a lot. And then all the gallbladder 13, 14, 15, stomach 8 is a really good point. And then around the eyes, bladder 2, yin tang, taiyang, triple heater 23, gallbladder 1, all great points for treating the eyes. And my favorite cheek points are right down the stomach line, stomach 2 through 8, love them. There's a cheek point that's 1.5 sun above stomach 5, right in here. And then small intestine 18 is a really good point. And then classic mouth points to treat the mouth, creasing across the lips. Large intestine 19 and 20, stomach 4 is always a great point for many, many reasons. And then there's a CV24, and then 1/2 sun lateral to CV24 is actually a really good point as well. Along the jaw area, you can do, again, all the points. Stomach 4 actually relates to the jaw area. That sun, 1/2 sun lateral to CV24. Small intestine 17, 18, triple heat 17. The neck, any of the points along the neck are really good. From the base of the neck, like bladder 10 and gallbladder 20 and 21 and on the M, all the way circling around to the neck area. Triple heater 17, small intestine 17, stomach 3, all the points along the clavicular ledge are really good points to use as well. So here's a video of treating the muscle area. And Jeff, can you make that, can you turn it on to move? Because it's actually a video.
Actually, I should have told you the video's actually going to play in the PDF. Do you have it online? Maybe I can pull it up and screen share it.
I do, but it's all right.
I'm sorry.
No, that's okay. Then this isn't going to work either. So this is actually a treatment, but I'm going to talk you through it. So I actually, what I did is this patient is coming in for a glabella creasing, the creasing between the forehead And so I did her treatment, pattern of disharmony. She has a lot of liver yin deficiency and liver invading the spleen. So, and she also gets headaches. So I'm going to be very, very cautious about the number of needles that I use. And I actually don't use that many needles. I could use maybe 10 to 20 needles on the face, and that's it. I know that there are pictures of people using hundreds of needles, but that's not me. I tend to try to be extraordinarily efficient in the needles that I use, because even though people are coming for acupuncture, they don't always like the needles. So by the time you put them in the face and you move up, by the time you put them in the body and you move up to the face, you've got kind of a limited number of needles that you can put in before they start cringing a little bit. So again, by knowing my facial anatomy, knowing my motor points, knowing where the muscles insert and attach, I tend to be extraordinarily efficient in terms of the needles, so I don't use a lot. So in this situation, I did my body points, and then I felt for gallbladder 20, or the tight areas around the neck, because remember that the head is attached to the neck and the neck is supporting the rest of the head. So you really want to palpate around the base of the neck, find those L.Ac areas, and then insert needles into the neck area. And then the other points that I did on her is I did bladder 2, directed into gallbladder 14, and gallbladder 14 directed into bladder 2, and I did them into the muscle layer. And then very superficially in the superficial and dermal layer of the skin, I threaded very thin serum needles through this glabella creasing that you can see between her eyebrows. And then because I wanted to do a little more, but I didn't want to use more needles, I actually did ear points. So I did ear shen men. I did on one side, I did the eye points, and on the other one, I did the face point. And that was my treatment. That was it. So now it's your turn. So remembering that dividing the face into the upper thirds. So the upper third is where the height starts, and then at the end of, as we age, it starts to drop down and move medially. Let's look at some pictures, and I'm going to ask you to take a look at the picture. In this one, the upper image is the before, and the bottom picture is the after. What do you see, and what might you do in terms of a treatment? And can you put that in the chat? What do you see? What might you see? Skin tone differ, good. Less sunspots, decreased wrinkling, fantastic. Softening lines, great. Good. Excellent, that's great. So are there any questions in the question box that I'm missing about this? Oh, Lama, hi.
Like, there are a lot of questions. I know, at least in regards to the last, when you were talking about the protocol, someone did want to know specifically which size of needles that you use.
Oh, that's a good question. I tend to do shallow insertion because most of my points are face related. And I use the serums. I use two kinds. I use serums, the red handled, so I think they're like 38 or 40 gauge. And then I also like the DBCs. I think they're made specifically for OMS, and they're fabulous needles. You know, they tend to be a little less expensive than the serums, and they're equally good, but those are the two that I tend to use the most.
For the serums, is it typically 1 inch, or do you use the ½ inch?
I use ½ inch.
½ inch. All right, so that would be the J15 with the tube.
Exactly. And then I also use them without the guide tubes as well. Like by the end of your treatment, you can have a lot of AccuTrash. So I try to be a little efficient, and I buy them in packs of 5, and I'm very careful about how I take them in, and I just kind of thread them into the skin.
Right. You want to go through the Q&A? We actually have a lot of questions.
Yeah, we'll do that, and then we'll. I do have some pictures that I want to show, but let's do some Q&A, and then we'll do some more pictures, and then we'll go back.
All righty. So let's see. Sorry, I'm just waiting for all of them to load because we have a lot of them. Alrighty. So somebody wanted to know, are those bony changes inevitable? Can they be delayed with acupuncture?
They can certainly be delayed with acupuncture and with diet and with lifestyle, as we all know. But at some point, it's going to happen. We just age. Aging is one of the givens in life, just as death. And so we will age. But I mean, if you look at when I was in China, what I thought one was the most amazing things to me was going through the park at 6 o'clock in the morning and seeing everybody out there doing qigong. And Asian women and men are gorgeous. Their skin is nice and soft and doesn't have a lot of wrinkles. And I think it's just the way that you take care of your skin and bone structure as well. As bone is a live tissue, and so the way that you protect it and take care of it helps to improve the quality of it over time.
Alrighty. And then can cosmetic acupuncture also help with hair growth and reduce the thinning of hair? Absolutely.
So hair is an interesting thing. Each hair shaft has multiple hairs in it. And so hair doesn't just grow, fall out, grow, fall out. It kind of hair pushes through. And as that falls out, there's probably about 7 to 10 pieces of hair in one shaft. And so as long as there is active hair growth in the shaft, you can keep it growing you can keep it stimulated, keep healthy hair growing. They say that once the hair no longer is in the hair shaft, it's hard to do. I don't really know. I don't dissect hair shafts and see what's in there. So.
Alrighty. What ages do the bony changes seem to happen, and how many years does it typically take? And then kind of second part of the question, is there a difference between their female or race?
Whoa. I don't know about the differences between the race. I do know that people's skeletal skeletons are different depending upon races. But I think that, again, using the concepts from a Chinese medicine perspective, it can happen if you are not taking care of your skin and bone and health well. Think of your kidneys. Think of your kidney jing. Think of your kidney qi and yang. The healthier you maintain your kidney system, the more integrity you have into those bone structures. So as we deplete them, things break down.
Alrighty. And then what about puffiness under the eye? Some have it, some don't, but it makes people look older. Is it because the fat is moving downward?
It can be fat or it can be water. So, and the way to know, and I will remove my glasses, is to look up and have your patient look up, have your patient look down, have your patient look up and have it look down. And you're looking at this puffy area. If that puffiness moves when you're looking up and down, that's water. If it stays stationary, then it's probably fat.
All right.
Okay, so let's do some more pictures and then some more questions. Okay, great.
Right, sounds good.
Okay, all right, here we go. Now, what do you see? The upper third is the before, and the lower third, the bottom one is the after. So what do you see here? Perfect. Yep. Those are heavy creases. Those are deep, deep creases. And you can actually see the glabella area. So, and in the glabella area is the middle. And you can actually see what causes that creasing are the corrugators. Corrugators are these little muscles. They look like a comma. And they go from bladder 2 to gallbladder 14. And you can actually see how hard they are and how thick. And after acupuncture, you can start to see them softening. And then as those muscles pull in and tighten, it actually pulls the whole face in, and it makes them look kind of angry, right? Whereas afterwards, it's much softer. Right? Yes, he looks like he's scowling. Yep, perfect. Okay, now what do you see in this one? So remember we were talking about the medial, the transition from into the medial plane. This, you can actually really see this a lot. If you look at her nasal labial fold, that fold between the nose and the mouth, and the puffiness that's in her cheek area. And in the after picture, you can actually see it starting to lift up and move outward. You can also see it in terms of the angle of the jawline. You can actually see the jawline, the entire face actually start to lift and pull back, and look what it does to her eyes. Look at the difference in her eyes. Yeah, good, everybody, good eyes, good going, everyone. Here's another one. In terms, you can also see that medial shift from the left to the right. And these are all pictures of, these are my patients. I took all these pictures. Well, I have them taken professionally. I do the acupuncture. Good. Beautiful. Nice job, everybody. And so this is the lower half, and you can actually see in the lower third, you can actually see the puffiness and the fullness in the cheek, in the lower jaw area, and then it's starting to tighten as she moves into treatment. Here, this is a great jawline picture. You can actually see loss of definition along the jawline, tightening at before the first and fifth and the 10th treatment. I like that one. This one is one treatment. So remember the point that's 1/2 inch lateral to CV24. That's the puffiness on the left side, and then after one treatment, it's gone. This is collagen, or loss of collagen, and here you can see in the left-hand side the pitting that we were talking about from collagen depletion, and then after 10 treatments, it's getting much fuller. This is a full face. This is kidney yang deficiency. Look at how puffy and swollen she is. And then after this, actually, I did more body treatment to treat the kidney deficiency and less face points. Now, this is a treatment with acupressure only. This is an instrument assisted. It's an acupuncture wine. It looks like this. I actually have this. This was what was in the Touch and Glow. Okay. And so this is, she was one of the people that was in the pilot study, 20 treatments. And you can see the visible difference in her images. And at first, when I looked at that, oh my God, did I stretch that picture to make it so tight? But in fact, that wasn't the case. It's actually her treatment. So what I have to say is about acupressure. For those of you who are still doing telemedicine or telehealth, or who are choosing to do more acupressure and less acupuncture, acupressure works. There is a lot of information, and I'm going to thank Dr. Campbell for this one. I took her class at PCOM and loved it. And so here's what I learned, that there are many randomized controlled trials that utilize some form of acupressure, usually in the form of a toothpick or retractable needle as a sham treatment. The RTCs, or these randomized clinical trials, often demonstrate that compared to no treatment, the sham acupuncture, or the acupressure, and real acupuncture, the Verum acupuncture, are effective. So when they do the treatments, results come up, and they show that you get a relative to no treatment at all, you get a 50% improvement with acupressure and 30% with sham acupressure or sham acupuncture. So what happens is the researchers then say, although there may be evidence to support the efficacy of acupuncture therapy for the intended condition, the results between sham and real acupuncture are insignificant. And then they say, although the researchers, the RTC researchers, believe that these results raise questions about the acupuncture's purported mechanism of action, the bottom line is both acupuncture and acupressure yield beneficial results. So you can get results with both acupuncture and acupressure. So, for those of you that are interested in learning more about facial acupuncture, I offer a mentorship and certificate training program. It's over 100 hours. Half of it's online and half of it is a mentorship. And the presentations online, and both in the week that we have the live, We have a number of different people, leader in the field. Really, we say that all of the leaders in the field are coming together to put together this amazing training for you. It's myself, it's Mary Elizabeth Wakefield, Lillian Pearl Bridges, Matt Callison, Michelle Gellis, Amanda Shell, and there's Elizabeth Tratner and more. So if you want to know more, here's some information. Also, there's upcoming presentations for the year 2020. There's Healthy Seminars in July, the SOMA, the Florida Conference, which I think is now online, and then the Pacific Symposium. They're still trying to figure that one out. And then if you want to follow me on Instagram, here we are. Thank you. So I'm here now. Let's do some questions. I'm happy to spend as much time as you want with questions, and you just cut me off when you're done.
All right. Well, we still have a bunch of them, and more will be coming in as you start answering them.
Okay,
somebody wants to know what causes hooding of the eyelids, and how do you fix it?
So hooding comes from, it comes from the bone breakdown and shortening of the bone. It comes from the tissue above the eye becomes weaker, and then the muscles that hold the eye open and close, that open and close them, become attenuated. So then it becomes you get hooding.
Okay, and then do you have some suggestions on how to treat it?
Acupuncture, you can, Yu Yao is a really great point. You can, I would just treat I would treat liver points, I would treat kidney points, I would treat Yu Yao, bladder 2, even stomach 8 is actually a really good point, because if you apply acupuncture to stomach 8, you can actually watch my eye, you can actually lift up the whole area.
Alrighty, and just so everybody knows, I am not looking in the chats right now. I'm only looking in the questions tab.
Okay.
And I also can't promise you that we're going to answer all of the questions before we have to go. So I'm going to keep asking, and we'll stop when we have to. Somebody wanted to know, so treatment on the face would differ as per muscle structure related to aging. Is that correct?
Can you say it again? I'm sorry. I was reading the chat.
That's okay. So treatment on the face would differ as per muscle structure related to aging? Absolutely. Yeah.
Talk about it. Okay, go ahead.
Next question, where does Botox get injected? At what level?
Botox gets injected into the muscular level. So Botox is a really interesting question. Botox, when Botox is a neuroinhibitor. So when you inject Botox into the muscle area, what it does is it prevents, so a muscle contracts and it sends out neurotransmitters, and the axon and the dendrites from the next muscle catch it, and it pops, and it just keeps popping along like that. And now you make a contraction. Well, Botox breaks that ability for the neurotransmitters or for that synapse of contractions to happen. So in fact, the muscle will spasm or pop and then nothing. So then the next muscle doesn't catch the signal. When this happens, what you're doing is you're not actually killing the muscle or paralyzing it. You're just stopping it from contracting. So when you apply Botox into the area, you're going to aim to the muscle.
Can skin spots fade? And then what can be done about liver spots and melasma?
Definitely. So melasma hormonal. So you treat with body treatments, you treat the hormones, and you can certainly start to break up sunspots. And I would actually do derma rolling. And Michelle Gellis sells a great derma roller. And so you would apply an oil, and I like safflower oil because I think safflower oil in Chinese medicine is it helps break up blood stagnation. So you can apply a little safflower oil to the area and then just roll in. It will out, or you can needle into the area, and it actually will to break up. And so if you have a solid spot, what you'll start to find is actually as it starts to break up, you'll see little skin. Normal skin as it starts to break. So it's not going to just fade, but it will fade and it will start to break down. It's like blood stagnation, treating blood stagnation with Chinese medicine.
And then also, I noticed before I moved into the questions tab, there were a lot of people were wondering for the before and after pictures, were those mostly just acupuncture treatments, or were there herbs and topicals and
No,
lasers?
yeah, no, this was just straight up acupuncture.
Okay. And then what about the use of internal supplements, topicals, or Soluma? Do you advise use of them?
I do, and that's another lecture. So,
all right, well, we know what topic to work on for next
there you go.
And then are the 10 to 12 TXs done once a week?
It depends upon the intention of the and what you're trying to accomplish. So for someone who's getting is going to a wedding or just they want to look good in a finite amount of time, you can do them twice a week. I've even done 3. I've actually had people come in from other states. They'll stay for a couple of weeks. I'll treat them and then they'll go back, and you can do 3 treatments a week, I think, at a time. If you want lasting results, you want to spread them out, because remember, with acupuncture, the healing comes not just when you put the needles in, but the changes that occur after the needles come out. So if you are really going for the long-lasting, extended treatments, then you might want to spread them out. And also for people who are older, it takes energy to make energy. And so when you are treating them, you need to be respectful for the amount of energy that they have, because you don't want to hurt them. You don't want to drain them. You want to build them. So even if it's an older person that you need to have more work done, you might want to spread it out weekly, or maybe even 7 days, to give the body a chance to heal. So what I do when I speak to my patients is I tell them, I'll give them the treatment. I'll say, now I need to know from you, how long did it last? Pay attention. How did it last? And then when you come in next week, let's talk about a more detailed treatment plan. Not only does that give me information, but it engages them too, because the hardest thing is to have your patient, treat them, have them come in, and you say, how are you doing? What did you notice? Oh, I forgot to look. You know? So you want them to pay attention. You know?
Makes sense. Do you use microcurrent or radio waves to enhance your treatments?
I use microcurrent at subsensory microcurrent. So I use it, and I use it a lot, and I really can. I think it's an amazing adjunct to your treatment, but it's an adjunct. Get your clinical skills down first.
And then when they are older, looking for prevention of this progressing, or when they are young in 20s and want to prevent wrinkles, no current wrinkles, can you explain how many treatments needed to start, or do they go into maintenance right away if for prevention?
Think of going to the gym. So this is really taking your face to the gym. So they're the muscles and the body tissues of the face. So when you go to the gym, how often do you go? Right? So probably you go several times a week, and then as your muscle development occurs, you can taper off. You can go a little bit less. Or so this is the same thing. We highly recommend that you get your 10 to 12 treatments in consistency. So keep the consistency of it first. So if it's twice a week or once a week, even if they're younger and healthier, I wouldn't go more than 10 days without treating them again. But I would say safely weekly for 10 weeks, maybe 12 weeks. And then when they're happy with their treatments or the results of their treatments, they will move into maintenance.
Alrighty. And then do you need a special certificate to practice facial acupuncture?
You don't need a special certificate. You need special training. So there are certificates. There's a difference between a certificate and a certification. A certification program is one that teaches a specific style, like say Mary Elizabeth Wakefield. She has a certification program. She teaches her style. It's a great treatment, great style. I really like her, and I like the way that she teaches and what she has to offer. She offers a certification program, which basically means you follow her training, and annually or how periodically you have to maintain that certificate with ongoing training. A certificate is a little different. A certificate is really a certificate of completion, that you have completed a training. So with that, I would say you should have a certificate, because like any specialty, you have when you come out of acupuncture school, you are really beginners in the truest sense of the word. And your knowledge really comes with your clinical experience and in-depth knowledge about, if you're choosing a specialty, about a specialty. Facial acupuncture is a specialty, and I highly, highly recommend that if it's something that you are going to specialize in, get specialized training.
Alrighty, and you have that 100-hour certification
We
program.
do, yeah.
And check your email 5 minutes after. There's a link to that program and where you can learn more from Shellie. So she has a lot of different classes on her website, and some are previously recorded, some are upcoming. So there's lots of opportunities.
Great. And I didn't notice in the chat that someone was having difficulty contacting me through my website. So please contact me through Instagram, or I will give Jeffrey my a more personal contact, that if you're interested in more information and you're interested in information or having difficulty that concerns me that someone couldn't get through, then I'll give you another way to get in.
Alrighty. And then for Bell's palsy, what level do you treat?
I do a lot. I actually just had a Bell's palsy case that I treated. I will treat on all of the levels. I will treat the muscle level, the bone level, and then I'll treat more superficially as well, but primarily muscle and bone and body treatments. And I will also do treatment with e-stim. That's when microcurrent's really helpful.
Do you use any topicals for sensitivity before you needle?
I do not. I just needle very carefully.
And you use sarin, so.
And I use sarin. There you go.
And then somebody wants to know, do you actually touch the bone?
I do. There's a technique called bone tapping, and we won't get into it now, but it's really good treatment. So.
And then which points do you use for grounding the patient in general, especially if there isn't a root issue that would require points on the lower extremities?
I'm going to let people answer that in the chat. What's your favorite grounding point, folks?
Oh, I like that.
3-mile walk. What is it called? Stomach 36 is one of my favorites. Or gallbladder 30. I actually look at too.
And then let's see. Are you just needling into the area, or are you pulling the skin up and pinning the skin in place?
Both. So, for example, if I'm needing into the glabellar region, what I might do is very shallowly needle in on a very, very superficial level. But if I really want to get that lift along the side of the face, I'm actually going to lift up and hold it. And stomach 7 is a great point, and stomach 8 is a really good point. You can even watch I lift. You can lift the whole face.
And then, does direction of the needles matter?
Sometimes it does, depend. Again, it's all about intention and what you're trying to create. So if I am needling into and trying to get muscular changes, I will needle towards the muscles. Again, if I, but for the most part, I'll either needle perpendicular or up.
How do you feel about indermal needles?
I like them. I'm gonna backtrack on that one. I don't have a lot of patience, so and I don't have a lot of time. So if I have to pull out those little needles with the tweezer and stick them in, I will not do that. I would much rather thread. But there's a new kind of needle out. Amanda Shale has it, and it's Ac-Regan, and you can actually pick them up with your fingers and slide them in, and I like those. So, but and then the other. You can get great results from intradermals, and no doubt about that. It's just, for me, it's just a time game, and then also you take them out, they end up floor, and okay. So.
Alrighty. I'm looking. Can you hear me? Okay.
Yeah.
Oh, perfect.
I'm looking at this bruising question. So, do I get much bruising? I did, but I got better at it. So in terms of bruising, one of the things I also treat is how to needle without bruising. So it's good skill to know. So every once in a while, and if I do get bruising, it's because I was careless and tired, and I just wasn't paying attention.
And so, I know we've talked about it a few times. A few people, it's still in the questions, are still more about kind of the sizing that you use for the needles. So with the sarin, it was the red, which is the 40 gauge, half inch, You use them with or without insertion tube. For the DBCs, was it also a half needle as well?
It's a 1/2-inch needle, yeah. I like
And then-
1/2-inch needles. I tend to be a shallow. Everyone is, some people are heavier needles, like Matt. He gets in there with long needles, and I'm the opposite. I'm leaning more towards the Japanese style.
And then, do you recommend any particular serums or herbs to take internally for various conditions? And
Go ahead.
Let's see. She also wants to know, do you have additional trainings, which we've just talked about?
Yeah, I will use herbs, but I use herbs primarily to treat the root cause. So, I did study herbal medicine with Ted Kapchuk and do minimal herbal. I'll do the basics, but if someone really needs herbs, I'm going to send them to someone that specializes in herbals, and I have no problem referring people out. I do use a lot of topicals, though. I have a huge knowledge base of different types of skincare products, and so that, yes, I do that.
Are there a couple lines or product lines that you're a big fan of?
It really depends on the person and what we're treating. So,
alrighty, that can be another webinar as well.
That's another webinar. There's so much information. Oh my God, I could talk for hours here. And yes, Deborah, they're the Thrive needles, the intradermals, Thrive intradermal.
With the little handles on them, I've seen them. Let's see. We're gonna end in about 5 minutes because it's getting a little late. But let's get through a few more questions before that. Do you have any suggestions for treating warts?
Those are viruses. Warts are viruses. So go back to your notes in your Chinese medicine and treat them, with your Chinese medicine and the immune system treatments.
And then, do you do anything for female facial hair?
Well, shave it. No, I don't. It's not something that I would treat as a treatment.
Okay. And then let's see.
Oh, Carolyn here, we're in the chat says, Mox says, work for me to have warts fall off. There you go.
All right, we'll try
Thank you, Carolyn.
Let's see. Does sleeping recumbent have any effect on nasolabial folds?
We all have a side of our face that's weaker and stronger. And that weaker side can be from sleeping on it. It can be from the way that you carry your bags. It can be from a number of things, but it is pressure on the face and it might have an effect. So probably.
All right. And let's see. Do you needle in an upward direction, and do you recommend maintenance treatment, and how often?
Did we answer that? I do needle in an upward direction, a perpendicular, and yeah. So maintenance is when, that's okay. So maintenance is anywhere from 3 to 5 weeks, and it really is dependent upon if someone is feeling really stressed out or they're having a hard time. It may be more stressful for them, and so they may see a visible difference sooner. If they're relaxing on a beach, on a boat, having a good time, then you may not need to come in for 5 weeks. But as soon as you look in the mirror and it's not looking great and you see the changes, get in there and get your maintenance treatment. But I pre-book them a month in advance, so they have 48 hours to cancel them or not.
Do you recommend any facial exercises?
There are a lot of facial books out there, and absolutely, it's not my specialty. I'm more acupressure, but I'm trying to remember. I can get you the answer to that, but there are facial exercises out there that are helpful.
Okay, and then how about acne? Are there specifics on the face for damp heat draining or just body points?
Oh, definitely body points. You definitely need to treat with body points. So like stomach 40 and some of the near the toes and Li4 are really good points for acne.
And then what was the process for jawline definition before and after?
The process?
That's what they asked.
I'm not exactly sure how to answer that one.
Well, let's move on. Let's get another
Okay.
question in.
Okay.
Let's see. Do you treat nasolabial fold by inserting needles locally?
No, because the nasolabial fold is a fold. It's not a wrinkle. So you can treat it, and it's a temporary, because it will create a light inflammation in the nasolabial fold. But really, what you need to treat is the rest of the midface, and actually remembering the ligaments and the tissue as everything moves medially. You actually need to just start moving things out and strengthen the tissue and the volume of the midface in order to take down or decrease that nasolabial fold. That's a good question, but that's yeah.
All right. Well, I think that we have answered enough questions for tonight. I want to thank you so much for this really informative lecture.
Great. Thank you so much, everybody, for coming out and being here tonight, and stay safe. So.
Well, thank you all for attending tonight. So please make sure to check your inbox 5 minutes after the webinar. So if you did show up late, there's a replay link there. Also a link to the slides so you can view those offline as well. And also links to where you can learn more from Shellie. So she has a lot of online content. She has some in-person stuff coming up hopefully later this year, God willing. And I just want to thank everyone. So our next webinar is actually going to be co-sponsored with the Pacific College, and it's going to be a panel style webinar on opening up. So it's going to be with a bunch of practitioners who have already started to open up, and they're going to share how they have implemented those OSHA and CDC guidelines. So please check for the registration on that. It'll be coming very soon. Have a wonderful evening, stay safe, and we will see you guys next time.
Thank you.
Thank you. All right, take care.
Take care. Bye.